I'm just moving that so I
Oh,
can keep it.
yeah, just move it anywhere. Good afternoon, everybody. Thank you so much for being with us here on chilly, cloudy, rainy afternoon to talk about COVID. We'll, of course, take your questions and whatever is on your mind today. So I'm going to begin by talking a little bit about the COVID numbers and these in our region as well as in St. Louis. These are not what we would hope that they would be. So I will tell you that yesterday we had 60 new COVID positive cases in the city of St. Louis. And that has been also been our average for the last 7 days, 60 cases per day on average. Now, let me tell you that that has doubled from the 1st of October. The 1st of October, our 7-day average for new cases was 31.6, so rounded up to 32. So that's just about double what it was a month ago. And that is for new cases in the city of St. Louis. Across the region, when you look at St. Louis County, St. Charles County, Franklin, Jefferson, Washington County, you're actually seeing numbers even higher than comparatively much higher than you're seeing here in the city of St. Louis. We are continuing to do lots of testing here. We've had in the city since this began 137,000 tests done. And of that 137,000 tests that have been done, and that may not be 137,000 different people, because some people have had tests more than once, but 137,000 tests done. We have 10,356, I believe is the total number of cases. So 10,000 out of 137,000 tests done have been positive. Now, moving on to looking at the hospital numbers. And these numbers are very worrisome. Yesterday in the region, and these numbers are 2 days old, you know that, there were 394 COVID positive patients in our hospitals, in all the hospitals in the region. That's up 150 people more than it was a month ago. A month ago, on the 2nd of October, it was 252. It was 241. It was 280. So I'm just rounding this off here that we have 150 people COVID positive more in the hospital today than we did approximately a month ago. ICU, 89 people in the region were in ICU with COVID positive yesterday. That's up about 15 people from where it was a month ago. And then on ventilators, this is kind of the only good spot maybe in these numbers. 41 people were on ventilators 2 days ago, and that compares, that's been about the same for the last month or so. So more people testing positive, more people going into the hospitals and in the hospitals. More people in ICU a little bit, not at this point, not too many more people, not more people on ventilators. Now, of course, what we worry about is that the people going into the hospital, people in ICU and the ventilators, lags when people get their test because they get sicker a week later or 10 days later. So that's worrisome when you're looking at the number of positive tests. Number of people admitted to the hospital 2 days ago was 56. We've got a 7-day average on that of 55. And a month ago, our 7-day average was 37. So about 18 more, give or take, people being admitted to the hospital each day. Also, we're continuing to have more people discharged from the hospital. So we had 60 people discharged 2 days ago. So all those numbers, and I know that the numbers make some of your eyes glaze over, but the bottom line of this is that we've got more COVID positive people we testing positive. We've got more people in the hospitals. We've got more people that are getting sicker. There are, what we know from the contact tracing is that most of these cases are happening between family members and between neighbors and close friends. Small groups, having a party at somebody's house, somebody's positive, they don't know it, of course, and then pretty soon you have a number of people that are positive. So a lot of people are doing a lot of hard work here and wearing masks and social distancing. But we know that there's COVID fatigue. We know that you miss being with your family, being with your friends. And so more people are taking more risk and having these small gatherings. I mean, every news station is talking about this across the country. I think it's pretty natural, pretty normal that this would be happening, but unfortunately, we're seeing the results of it in more positive cases. The real the additional, I should say, crisis of this is the capacity in our hospitals. Our hospitals are still doing elective surgeries, and they do have enough beds right now, but they're worried about their capacity. Not just in beds, though. They're worried about their workforce. They're worried about the nurses and the doctors and the people who work in the hospital that care for people. And that workforce is tired, they're frustrated, they are, they're burning out. And so it's one thing to have a bed in a hospital, but you got to have those good folks there to be able to take care of you. So we just all have to try to be more vigilant, and even though you are tired, try to socially distance, wear your mask, and not interact with lots of folks. So that's COVID. Our positivity rate in the city is running at around 8%, and that we were at, just a few weeks ago, we were down under 5, just a hair under 5. So our positivity rate is going up as well. We know that, and I think there was a press release done about this yesterday maybe, from our health department. We know that the zip code that has the most cases is 63116, and that's in South St. Louis. And so Affinia at 3930 South Broadway is doing more testing. This is in cooperation with the state and the Missouri National Guard. They have asked that it's open to anyone, but they have asked that you sort of make a reservation, if you will. They don't need a lot of people waiting in line. So if you want to get a test, if you need to be tested, Affinia is doing even additional. They've always been doing testing, but they're doing more testing now, and they have the additional help with the state and the National Guard to do that testing. And so that is going to be on Tuesdays and Wednesdays from 9 to 5, starting next Tuesday on Election Day. So that's if you feel like you need to have a test or want to have a test. I would say this, I know that there are a number of people that in some ways are using testing to then go and interact with another group of people, or maybe they go out of town and then they come back and they say, oh, I'm going to get tested. And this is, I think, particularly true among young people. Rather than doing that, just keep your circle small and don't take those additional chances, because what we find is that you're being responsible in getting yourself tested when you get back or after you get together with people, but by then you're already exposed. So please, again, most of the positive cases are people in their 20s. The next biggest group are people in their 30s. So it's just a very serious situation. That the state of Illinois recently, I think it went into effect today. Is it today? Yes, they are not having any indoor dining or any indoor bar seating, only outdoor. Well, you know how that goes in this kind of weather. And so that is, we hope that we don't have to do that in the city of St. Louis. City of St. Louis and St. Louis County, for that matter, have really taken a lot of precautionary steps. Not so true in the outlying counties. And so we are seeing a lot of people from zip codes outside our immediate region here, outside our immediate city of St. Louis and St. Louis County, who are coming in, and they are driving the numbers in our hospitals. But it doesn't matter where you're from, you still need that hospital bed and you still need the people to take care of you. So that's COVID. We'll take your questions about that. A couple things. It's National First Responders Day. And so thank your first responders, police officers, firefighters, EMS, paramedics, dispatchers. These are all our first responders. And of course, we'd want to thank them every day and every year, but this year especially. They are the people on the front line. So thank you, St. Louis Police Department, St. Louis Fire Department, EMS workers, police and fire at the airport, dispatchers, all of you who are our first responders. Thank you. And then the next thing, before we go to your question, and I won't sing this to you, happy birthday to the Arch. The Arch is 55 years old today. I said to some of the people in my office this morning, happy double nickels. It's kind of an old saying, but some of you will appreciate that. So happy birthday, 55 years to the Arch. The Arch is, the Arch says St. Louis. All over the world, people see the Arch, they know that that's the St. Louis Arch. So happy birthday to the Arch. Now, questions.
Quite a few questions today, Mayor.
Okay.
First question has to do with hospitals. Are you concerned about the available hospital capacity in the city of St. Louis or the St. Louis region?
I'm concerned about it. The hospitals are watching it every single day. Yesterday we had a call with all the heads of all the hospitals. They are concerned about it. They don't want to have to stop doing elective procedures, but that may be on the horizon, but that has not happened yet. Everybody's watching the numbers very, very closely. And you've probably seen this. All of the hospital personnel, all of the public health departments, they're really just begging people to wear a mask, socially distance, stay within a small group, and don't take unnecessary risks. So, been a lot of public service announcements and about that. Because yes, we're concerned about our hospitals.
Second question, what do you think our path forward looks like in the city and the region over these next few weeks, especially as the weather gets cooler and cooler and flu season becomes more of a concern?
Our path forward, the only successful path forward is to spend more time at home if you have to be indoors, and we know you do in this kind of weather. Be sure you have a flu shot. Still plenty of time to get a flu shot, but time to do it, because it was early October, maybe the end of September, when flu shots started being given. So get a flu shot and wear a mask. This is not a political statement. Just wear a mask. When you think about the sacrifices that other generations have made, primarily having to do with wars, because we haven't had a pandemic, you think about the sacrifices that they have made, and then the ask to wear a mask is really not that hard. Hardest thing about it's remembering it, right? I went to the store over the weekend. It was on Sunday afternoon. Of course, I had my mask in the car, but I wasn't wearing it while I was driving alone in the car. Got out of the car. I went, hurrying up to the front door. I hit the front door and I was like, I got to go back and get my mask. Ran back to the car, get my mask. I mean, it's not a big deal.
Quite a few questions about additional restrictions or mitigation strategies for the city or the region. Nancy asked, is there a threshold that maybe you or the county executive or the hospital are looking at for when we might have to do, whether it's a stay-at-home order or additional restrictions?
So we're talking about that now, and nobody wants to put additional restrictions on if it can be helped. We're asking people to modify their own personal behavior. We're having a hard time persuading some people just to wear a mask. So what are these additional restrictions? You know, bars and restaurants are already closing at 11. Large venues are already at 50% occupancy for events, already required to socially distance. So we're really asking people to modify their own personal behavior. But yes, we are talking about what some of those things might look like. But when you consider that we know that these cases that we're having, they're not happening in large venues, they're not happening in schools, they're happening at home. They're happening among neighbors. So what restriction could we put in place that would prevent people from getting together with their neighbors, their small group of friends, or their family? There aren't any. So
11 p.m. curfew. That has been on effect on our bars and restaurants for quite some time. What's the future of that look like in the city of St. Louis? Are we looking at carry-out only, potentially, like we had in the spring earlier this year?
So, you know, I just talked with someone this morning who really wants the bars and restaurants to be able to stay open until 1:30 or 3 a.m. And as sorry, I'm extremely sorry that we can't lift those restrictions. But with these kind of numbers that I just went through with you, turn on the TV or turn on, for those of you that get all your news from the internet, just look at any news source and you will see that we are not on a trajectory where we're going to be able to lift that 11 p.m. closing time. I hope we don't have to do even more, because I know that when we restrict restaurants, bars, event spaces, hotels, ballrooms, when we restrict that even more, we put even more people out of work. When we put more people out of work, we have even more people who need rental assistance, who need utility assistance, who really are extremely stressed. So I am sorry to say we are not going to be able to get rid of the 11 p.m. closing time anytime soon.
Rachel has a question related to COVID-19. How much of the increases that we're seeing in the city and the region is due to the ability to test more people, or is it more rooted in just community transmission?
Well, Rachel, I think it is rooted in community transition. And when I say I think, this is what Dr. Eccles thinks, and this is what our public health department thinks. It is rooted in community transmission. And if it were just that we were having an increase in the number of cases, then you might be able to say, oh, well, that's because we're testing more people. But that's not the case, because if that were it, we wouldn't have more people in the hospital. So we know that our hospital numbers, 7-day average is up 150 people over what it was a month ago. So it's not just about testing. Testing is something that we need to do. It's something that anyone who has any symptoms or feels that they've been exposed certainly needs to do. But it's not just that we're finding the positive cases, because those people are also getting sick enough to go into the hospital. So
we did get a question about 63116, and I think you may have sort of addressed it. What is the health department learning about how that virus has spread? North St. Louis used to have some of the hottest zip codes, and now it's in the south. What's driving the increase?
People getting together. That's really what's driving the increase. At least that's what the contact tracers say. You know, it's not big, huge events that are driving this. I'm looking to see if I've got that map. I may not today. There was a map, and we'll find it and put it on the website. Or did we put it on the website this morning? Did we tweet about that? I thought we did. Okay, so it is folks getting together. And so why are they getting together more in 63116 than they are in another zip code? Might have something to do with demographics, maybe more young people in that zip code. Older people have over the last couple of 2-3 months really gotten the message, and they're being pretty careful. But social gatherings, small social gatherings among friends.
Kristen has a question about the lives that have been lost due to COVID-19 in the city. How has the death toll from COVID-19 fared as cases have continued to increase and more people have gotten sick from COVID-19? Is it decreasing, staying the same, or?
You know, Kristen, luckily it's decreasing. And I know that there are people who say, well, not very many people die from COVID-19. We've had 211 people in the city of St. Louis who have died that are COVID positive. You know, I mean, you can say, well, that's not that many, but frankly, it's 211 people. And it's about the same number of people that we've had die in the city this year from gunfire, from homicide, usually gunfire, both of which are pandemics, by the way. Violence is a pandemic, of course, COVID is a pandemic. But since COVID first began, middle of March, the doctors know more about how to treat it. More people are being tested, so if they do get really sick, they're going into healthcare, into the hospitals, whereas that wasn't necessarily the case early on. And so we're getting better. The medical community is getting better at treating people that are COVID positive. We're having more discharges. We're having fewer deaths. That's all a good thing. But, you know, there are a lot of people that have had COVID, 10,400 in the city, 10,356. And you might say, well, oh, wait a minute. Did I give you the wrong number there? Positive. That's the number of positive cases. So, and of those, 211 have died. But that's just not a risk that you want to take. So let me straighten out a number that I gave you. I've got two numbers on this page. 10,000 positive cases. That was 8,300 positive people. People tested more than once. So, doctors are getting better. We know more. We've got medicines now that can work. But a lot of people have long-term effects from this.
We have a question about schools from Terry, Mayor. So with increasing cases in the city, what are the chances of schools returning to just strictly online or virtual learning? And how are things been going since SLPS returned in person?
Well, SLPS just returned in person a week ago for the little kids, this week, 3 days ago, for the little older kids, 3rd, 4th, 5th grade. Things are going pretty well in terms of number of cases. That's because our health department has worked very intensely with schools on their infection control procedures. I won't speak for Dr. Adams in terms of whether or not he's going to put the brakes on that, but I think right now things are going pretty well. I know that it's a strain on everyone. It's a strain on the kids. It's a strain on the teachers. It's a strain on the other personnel that work for the school district. The Catholic schools in the city, parochial schools, have been in person all year. Things are going okay there. Some of the independent schools have also been in person. Things are going okay there. And then there are some schools, some charter schools, that are on split schedules, 2 days in, 2 days out. Everybody's trying to figure out how to do this and how to educate kids and keep kids and staff safe. So it's certainly a challenge.
Okay, we have questions on other topics, Mayor. Lindy submitted a question asking about what you or someone in the city can do to help Missouri become the latest state to allow early voting. Won't make it for this election, but maybe one in the future.
So, Lindy, that is, I'm in favor of early voting, always have been. Our state legislature is not in favor of it. So that is something for you to write or call your state representative or your state senator, because that would have to be done at the state level. All the election law is at the state level.
Portia submitted a question also about the election. How much time, because some companies have announced time off for people to work next, or to vote next Tuesday, how much time do city workers get on election day to make sure that they're able to vote?
So I believe that depends on what hours you work, but I believe what our policy is 3 hours. But if if you don't go to work till 8 o'clock, so you've got the 2 hours before you go to work and 1 hour afterwards. So it's not that you get 3 hours off in the middle of the day, because the polls are open from 6 a.m. to 7 p.m. So if you need additional time, then part of that will come out of your work day and part of that will come out of the time that you're not at work. We want everybody to work. And let me say this, we also don't want anybody having to leave the line if there's a line, and there's likely to be a line, so that they can get to work. So work this out with your supervisor. I'm assuming that you're a city employee. Work this out with your supervisor so that you can vote.
Two last questions, Mayor. When or how soon will a new relationship with behavioral health response begin working? And when will we know that this new approach is actually working, making a difference?
So the contract starts November the 1st. We just approved the contract at E&A last Wednesday, I believe it was. Starts November the 1st. People will be hired, people will be trained. It'll really be, we anticipate it'll really be up and running by the 1st of the year. So there's a 60-day period in there where everybody's got to get trained and hired and that sort of thing.
Last question for today. Personal gatherings you mentioned, Mayor. We got a question about Halloween and Thanksgiving, both of which are coming up. What is the health department's recommendation to be able to enjoy these holidays safely and responsibly?
So on October the 1st, the health department put out its recommendations for Halloween. I'll give them to you in a nutshell. The recommendations are long, but I'm going to give them to you in a nutshell. Only trick or treat with your own immediate family. So mom or dad or grandma or the aunt, whoever takes kids trick or treating, only do it with just you and your brothers and sisters that you're with all the time. Don't trick or treat in a big group where you're exposing your adults and kids to another group. For people giving out candy, don't have a bunch of kids all shoved together on your front porch. I know how that is. We have a lot of trick-or-treaters where I live normally. So one group at a time, and have the candy bags already made up. You know, get some little sandwich bags or whatever, so that you don't have kids, putting their hand into a big bowl of candy and pull it out. They look at the candy. Oh, they didn't like that candy they got. They throw that back. They go in for that. That's really not a good idea. So if you're going to trick or treat, and I know that a lot of parents and a lot of folks who give out candy are opting out this year, just because the risk with COVID. So if you're going to do it, be sure you take additional precautions. One idea is for a block or a street to have a trunk or treat, meaning you've got all the candy already made up in bags and people can drive through and everybody gets handed a bag or whatever. So Halloween is going to look different this year, and you've got to wear face coverings, not just the Halloween mask, COVID face coverings. Thanksgiving, I was just talking to my own family about that last weekend. And normally we would get together with our relatives, our out-of-town relatives. I've got a sister in Omaha. I got family in northern Missouri. Normally we would get together either the weekend before or maybe even the weekend of Thanksgiving. Well, we're not going to do that this year. We're not, those are not groups of people that we've been around since COVID, because they're, you know, several hours away. And it's going to be tough. But I think it's just going to be our immediate family who we have been around. And, you know, it's going to be tough, but that's what we're going to do. So
That's it for today.
that's it. Thank you all. Thanks for joining us this afternoon. Please do your part to modify your behavior so that you don't get COVID and you don't expose anyone else to it. We're in a very serious situation right now. So thank you all. I know that you're all doing the best you can, and we'll all get through this. Thank you for tuning in, and we'll be back with you. You know, I don't think we're going to be here on Friday because we've got a little something else planned. So if I don't see you at this natural briefing, have a great Halloween. Be careful if you're out. Consider some alternative forms of fun to trick-or-treating. Thank you all.